The right way to work with your dental assistant. Hi, I'm Dr. Avi and I'm a dentist. In my career, I've worked with several different types of dental assistants. All of them have different levels of experience and definitely different personalities. In this video, I'm going to share with you some tips on the right way to work with your dental assistant. What is a dental assistant and what exactly do they do? A dental assistant is formally called a registered dental assistant or an RDA. They are, in my opinion, your lifeline as a dentist. Without our RDAs, there's no way we're able to actually do our job. Don't get me wrong, everybody in the dental office is essential for your day to go smoothly, but the RDA takes it to another level. The RDA is quite literally your second set of hands. They keep the office moving forward by ensuring that our patients are being taken care of while we are not present in the room. Some of the things that they do, they set up the room, they break down the room, they sterilize the instruments for our procedures, they take records, they make temporary, they take radiographs, they even schedule patients. They do all this stuff and so much more. So given that they do all of this stuff to help you and your day go smoothly, you have to remember to treat them with respect, appreciate them, and treat them with kindness. I have heard from dental assistants that they were treated very differently in previous practices by the dentist. Some of them had said that dentists yell at them, throw things at them, get upset and frustrated. That is messed up and it is unacceptable behavior. It blows my mind that dental assistants don't get treated nicer in our profession. They do so much. The least you could do as a dentist is just show some appreciation. And the easiest way to know how much your dental assistant does for you, try navigating a full day schedule of patients without your dental assistant. Give it a try. You will feel levels of stress that you have never felt in your life. You will be begging for your dental assistant to come back to work and you will never want them to ever leave you again. Trust me, I've been there. So I love my RDAs and I'm super appreciative of everything they do. Over the years, I have had the opportunity to work with several of them. You gotta remember, every RDA is different, okay? They all have their own experiences and their own skill sets that they have acquired over the years. So you cannot treat each and every one of them the same. They have worked with different doctors and you gotta remember, every single doctor does everything differently. So when you're first working with an RDA, you have to be patient with them and give them a little bit of time to sync up with the way that you like to do things. You also need to be very clear on how you like things done. This requires you to know what you like. If you say that you don't care how something's done, you need to mean it. For example, if an RDA asks you how you like your setups for composite fillings and you say that you don't really care, you cannot be upset when an instrument is missing from the composite setup because you told this RDA that you don't care how the setup is. RDAs are amazing human beings, but they are not mind readers. So when they ask you if you want things a certain way, you need to know how you want things done. Then you need to tell them how you want it. This way, they know what's expected of them and they can ensure that they're taking care of you. It is their job to do so. When I first started working, like many other dentists, I made this mistake. I said I didn't really care about stuff, and the RDA listened to that. And during procedures, when things were missing, I'd get frustrated when things were missing. The problem was not the RDA, it was me. I didn't know what I wanted, and I expected the RDA to know what I wanted. That's not fair. As a dentist, you gotta figure out your style and your preferences, and the sooner you do that, the better off you're gonna be. Once you know those things, communicate it with your RDA so that way you guys can get synced up and be on a much faster path to success with each other. When you and your RDA are on the same page, you will find that your work is going to be way more efficient. You're going to be able to provide a higher quality of care and your days are going to just be more enjoyable. Now, the experienced assistant is a blessing and a curse in my opinion. They are super knowledgeable and they are loaded with experience. This is great because they can actually get really close to reading your mind. They'll know things that you need before you even ask. Being on the receiving end of being spoiled from an experienced RDA is amazing. But something that I found is when an RDA has a lot of experience, Sometimes you might rely on them a little too much. You may find yourself asking them about certain protocols for things that you, in fact, should know. This can be tricky. An example of this, I was working in an office and I was the new provider. The RDA had been there for 15 years. We were doing a basic procedure and I knew all the materials in the office, but I was not so familiar with some of the brands, okay? So the protocols for some materials were a little bit different. I found myself in the middle of a procedure asking the RDA how long the curing time was for a material that we were using. The RDA knew and told me, and the procedure went just fine. That, however, is not a good way to practice. It is not the RDA's job to know these things. I was fortunate enough to be working with an experienced one who knew it. So instead of doing my own research and knowing exactly what I needed to know about that material, I relied on the assistant. Now, this is a very simple example. However, you may find yourself in a more complicated situation relying on them, and that is when things can get dangerous. Don't make this mistake. At the end of the day, you're the dentist and you're liable for everything that happens. So don't rely too heavily on your RDA. Another challenge that can present itself with an experienced RDA is they can be a little difficult to mold or change their ways in doing things to fit your needs as a dentist. Something that may happen is you may find yourself doing what the RDA thinks is comfortable as opposed to the other way around. It's an interesting dynamic, but younger dentists fall prey to this all the time. A simple analogy that I can use to demonstrate this is if your RDA is flying the plane and you're on autopilot too often, that's a problem. Remember, you are the dentist. You are in charge. You are liable. You need to be involved in your procedures and cases. Don't be afraid to tell your RDA that they are doing too much if they are in fact doing too much. Sometimes they get excited and they like being hands-on, so they really want to be super active and doing things, but you have to remember that there are limitations to what they can do. It varies by state, so know what the protocol is in your state and follow it. You never want to make the mistake of handing over the reins completely to your RDA. That's when you lose control and that's when you can get in trouble. I hope you found this video super helpful. If you enjoyed it or you learned something, please drill that like and subscribe button and share it with anyone that you think may benefit from it. Thanks for your time. See you later.